By and large, this COVID virus is a respiratory virus. That means it predominantly affects your lungs. The symptoms related to the lungs still predominate, like patient can have a dry cough, patient can have breathlessness, or patient can have symptoms chest pain because of the pneumonitis, and they can also have upper respiratory symptoms like loss of smell, they can have loss of taste, and they can have even running nose. These symptoms fairly remain common as we see in the first wave of the pandemic. But however, now we are seeing more patients presenting with extrapulmonary symptoms, like patient comes to you with diarrhea, and later you take a RT-PCR, that patient comes out to be positive for a COVID. So diarrhea is one symptom which we are seeing more frequently now. And apart from that, severe weakness and lethargy is very common. That was seen even in the first wave, and similarly we are seeing it in the second wave also. And in addition to this COVID is also capable of causing sudden vascular events, like patient may present to you with a brain stroke, patient may present to you with a heart stroke or a heart attack, and patient may present to you with a lung stroke, like where there is a blood clot in your lung circulation. So these symptoms were seen even in the first wave, and we are seeing it even in the second wave, but these are not the predominant symptoms. Still remains the respiratory symptoms, like in the form of a dry cough or breathing problem or chest pain. But we are seeing more of a gastrointestinal symptom, like patient having diarrhea and loose gas. So any patient who develops fever during this point of time should get screened for COVID. Fever may not be present in all patients of COVID, but when you have fever, then you may be at a higher chance of having a COVID-19 infection. One common misconception, especially from rural areas and people, even doctors practicing in peripheral setting, is they do a test called as a Vidal test. And unfortunately, patient has got a fever and the Vidal test comes somewhat positive. And most of these patients are assumed to have a typhoid and are treated on lines of typhoid. But when they actually present to us and we get a COVID RT-PCR, it comes positive. This is just an observation. I do not have the statistics to share with you. This is what we are observing. So any patient who has got fever, kindly do an RT-PCR. Probably you are missing out on a COVID-19 infection. It is just yet another viral illness, and there is nothing to be very specific that you have to take only this to boost up your immunity. Yes, definitely you need to have good nutritional food in the form of fruits, in the form of green leafy vegetables, and you need to maintain your sugar levels, especially if you are a diabetic, because uncontrolled sugars are one of the important risk factors of changing a mild COVID to a severe COVID because of your suppressed immunity. And one thing is you try to keep your food light when you are going through this phase of COVID, because you will not have a taste or a smell and you will find the food unpalatable in few patients. So you need to keep your food light, and apart from that, there is nothing called as a specific nutritional addition which you have to make, because it is yet another viral illness, and we have gone through such viral illnesses even before. But however, now we are in a pandemic scale.